Welcome back. Every Way Woman is so excited to welcome Dr. Nimmi Kapoor to the show. Welcome.
Thank you.
Welcome.
So we just want to take a few minutes to basically break down what it is that is this big, scary breast cancer. What is it?
It's really scary when patients are confronted with it. It's like a whole new world has come all over, so breast cancer is really just uncontrolled growth of cells, and it starts with changes in the DNA, and it starts within the breast tissue. The breast is made of lobules that make milk, and ducts, which are the tubes that get the milk out to the nipple. So that's where breast cancer is, and it starts in the cells of those ducts and lobules.
How does it, how does it happen? I mean, do you contract it? Does it grow? Do you pick it up from out? I mean,
what are the risk factors?
Yeah, how does that, and the symptoms actually?
Patients are like,
yes.
how did this happen to me?
Right.
No one in my family has it. Why? It's a combination of genetics and environment. We don't know the answer to everything, but we do know that breast cancer is just changes within the cells. It happens because of environmental stimuli, because of exogenous hormones that we ingest from foods, from hormone replacement. It comes from our own genes, our family history.
So I just wanted to ask you a little bit about hormone replacement therapy, because my mom got breast cancer, and she was on hormone replacement therapy, and same thing, she had no idea that she was going to get it, and so now I'm not as worried, because I feel like, oh well, it was through hormone replacement therapy, I don't have to worry. Do I have to worry?
Well, it's so common, 1 in 8.
Right.
And as we get older, our risk keeps increasing up to the age of 80. And while it's nice to say, oh, it must have just been the hormones, doesn't mean you're totally free from the risk. And hormone replacement, especially estrogen with progesterone, over a long period of time, 10 years of that kind of hormone replacement, increases your risk.
And I think also it really affects a lot of different women from different cultures, nationalities, everything across the board. It isn't just for one or another. It crosses boundaries everywhere.
Absolutely.
And ages too.
Absolutely.
I mean, many younger women today are seeing more of a problem with breast cancer.
Yeah,
I have a question real quick. In going back to the hormone therapy, now as someone who takes birth control, is that considered a hormone supplement? Will that affect my risk factor of getting breast cancer?
Prolonged hormones will have an increased risk, especially when you're when you go through menstruation early, when you go through menopause late, when you don't have pregnancy early in age. So when you get pregnant, you kind of block those hormones that your breasts are exposed to, so you have a break, basically, from the hormone exposure. So all of that goes into your increased
Dr.
risk.
Kapoor, let me ask you a question. We're talking about hormone therapy, and we're using some really big words. But even before I get to there, what are some of the symptoms? What should I be telling my young daughters or the people around me to be looking for, even before I get to there? What are some of the symptoms?
Right. So this is important. It's really important to know your breasts. And you don't know symptoms unless you really know what your breasts feel like, what normal breasts are. Everyone's breasts are different. All of our breasts are lumpy in one way or another.
Sure.
So if you
Mine
don't
are different sizes.
Exactly.
Especially if you find a lump, that doesn't always mean it's cancer. It is alarming, and it is important to check it out. And I think that's really important. Women should not be afraid.
Women should
absolutely
definitely not be afraid. Thank you, Doctor. We'll be right back after this.